As students head to the classroom, so does the potential for viruses, germs, and other shareable things that can make you sick. So joining us today to talk about fighting off these problems is Michael Hawkinson, the Public Information Officer of the North Central Health District. Thanks so much for joining us in studio today.
Thanks for having me.
Of course. So in regards to students and teachers and staff headed back to the classroom, what are some good tips that you have to offer them in terms of being in their best health and staying healthy?
So it's a good idea for parents before their kids actually enter the classroom to talk to them about germs. We know that not everybody really understands how they spread, how they might make you sick, but warning your children about sharing toys, putting your hands near your eyes, your mouth, your face, where you might be able to interact with some things that might lead to some illness. We don't want our kids to get sick, so just kind of instilling that knowledge in them about how they can actually protect their own health when they're in those settings as well.
Yeah, you kind of already touched on this, but just reiterate for us, what are some of the common mistakes that people are making to spread these germs around?
Absolutely. So we say that sharing is caring, but in an environment with a bunch of little kids, it's important to see how they're sharing, making sure that those toys are cleaned and disinfected in between use, especially those very, very young children that might not be in school but in daycares, where we know that they tend to put things near their mouth and nose, tend to put their hands near their mouth and nose, and then touch surfaces, touch objects. That can lead to a spread of illness if that child's already carrying something that's already contagious, or if they're already ill themselves. So those workers out there that are monitoring these environments, just making sure that they're creating a safe environment as possible.
Yeah, I know obviously we're talking about school, but this is good advice for the workplace too. When
Exactly.
You're sharing a desk or a laptop or
Absolutely.
touching a door handle, those germs can easily spread. So just because you're not in school, you still want to be mindful of these tips as well. Talk to us about RSV. First, what is it and what are the symptoms of RSV?
So RSV, or respiratory syncytial virus, it is a respiratory illness, as the name implies, that can lead to some severe outcomes, but in a lot of cases it just presents itself as a lot of respiratory illnesses do. And that's one of the pitfalls when it comes to these respiratory illnesses, is without specific testing there's not really a lot somebody can do to determine what exactly they have, because they present symptoms similarly: coughing, wheezing, drippy nose, runny nose, sneezing, things of that nature. But one thing, it's important for those that are most at risk to get the vaccination against RSV. It's not open to everyone. It's for very young children, the elderly, as well as some of those senior citizens that might have underlying medical conditions that RSV could exacerbate.
Yeah, I know you just mentioned senior citizens. Are they the most vulnerable? Are there any other groups that might be more commonly vulnerable to this?
So the groups that are able to get the vaccine are those that are considered most vulnerable. Like I said, those very, very young children, we're talking 6 to 19 months old, as well as those senior citizens, 75 plus especially, but those that are 60 to 74, if they have an underlying medical condition, if they were to get RSV, that could lead to a more severe outcome of the illness that they're already dealing with.
Definitely. We're also coming up on flu season. Talk about how it typically hits our area.
So flu season in Georgia usually starts in October and can go through mid-May, but flu can be active any part of the year. One thing that's important to note is that we do see higher spikes around the holidays, and of course that's kind of to be expected when we're all in those confined spaces together, parties, dinners, things of that nature, where we're coughing on each other, breathing on each other. So it's important to get that vaccine early on in the season, so you've got that long-term protection, which reduces the risk of getting the flu. And if you get the flu, if you've already been vaccinated, which can happen, it's not a 100% shield against the flu, it will lead to less severe outcomes, less severe symptoms.
Yeah. Is getting the vaccine the best thing you can do to fight off, or is there anything else you can be doing right now to kind of prep yourself against the flu?
So that's still one of the best things you can do, but just like talking with protecting against other illnesses, flu is also a respiratory virus. So making sure that you are having a clean environment, washing your hands before you're touching your face, your nose, anything like that. And of course, one thing that we definitely want to stress to people: if you are feeling ill, don't go to work, don't go to school, take that time off. You don't want to be the reason why other people get ill as well.
Right. One of the last illnesses we want to bring up in this segment is COVID. Obviously, we aren't in the peak pandemic of it all, but it's still out there. What
Absolutely.
can we do to continue to make sure that we're operating in a safe environment with that?
So We're talking about respiratory illnesses. COVID-19 is another one. Taking those same steps for personal protection, taking those steps for protecting those that don't really have the ability to protect themselves. And of course, as CDC still recommends, making sure that you get that up-to-date COVID vaccine. If you haven't considered that, making sure you talk to your healthcare provider to see what's right for you in that specific situation.
Alrighty, well, thank you so much. We're going to continue this conversation in our 8 o'clock hour when you give you some more information that you may not know about the North Central Health District. Stay with us. Thanks for staying with us. In our 7 o'clock streaming hour, we talked about some important health tips to keep in mind as our students and teachers return to the classroom this year. Joining us in studio is Michael Hawkinson. Thank you so much for joining us. You are the Public Information Officer over at the North Central Health District. In our 7 o'clock hour, we did mention some of those tips, but just real quick, if you can reiterate some health tips that people should keep in mind as their students are headed back to the classroom.
Absolutely. Well, one of the most important things is to make sure that you're checking in with your healthcare provider about those recommended vaccines for students. There's a list, and it's important to make sure that those kids are vaccinated at the appropriate age. There are some very time-specific vaccines to get that level of protection that's important. But of course, outside of vaccination, making sure that they know about germs, they know how germs can spread, they know why germs lead to that illness and what they can do in terms of cleaning surfaces, making sure that they're not touching their nose, their face, their eyes, or anything like that with dirty hands, and making sure they know how to handle a cough, handle a sneeze, making sure they're not infecting others if they're feeling ill.
Yeah. Now, obviously, there's a lot of services that you guys offer, whether it be for teens or kids. Talk a little bit about some of those services in case people are unaware.
So when it comes to teens and kids, we do offer a large variety of services. A lot of our services are very child-focused in that specific area, and they do have some specific eligibility requirements, programs like Children's First, Children's Medical Services, Babies Can't Wait. Those are very specific services that you can find the eligibility requirements on our website. In terms of other services that people might not consider, we do operate the environmental health services for the 13 counties that we oversee, which includes things like hotel inspections, restaurant inspections, regulating body artists and things of that nature to keep a whole environment safe rather than just the individual. We also do services like emergency preparedness. We also have our Hope Center, which is an HIV treatment clinic for those that are living with that illness. But we offer those clinical services as well, things like STD testing. We offer vaccination. We have travel clinics across our district as well. So we want to approach the individual as well as the community to make sure everyone is safe and everybody has access to those services that they might not consider but are definitely important in our community.
Yeah, the Department of Health has offices all across Central Georgia, so make sure you're checking it out if you need to utilize one of those resources. Speaking of the North Central Health District office specifically, you guys just got a new employee, a new director actually.
Absolutely.
Talk to us a little bit about that and what that means for you guys.
So for the past few years, we've actually had an interim health director, which was Dr. Thomas Kraft of South Central Health District, and we definitely want to thank and recognize all the great things that he did while he was with us, but we are also excited to announce that we have our own new health director in Dr. Kim Cook, who comes to us with a wealth of experience in epidemiology, preventative medicine, as well as clinical research. And I know that personally I'm excited for him to be here, but I know that it's going to be an interesting future for our district with somebody with such a great level of experience that we can tap into.
Yeah, the office also offers some emergency preparedness. Talk about some of those programs and what people should know about that.
Absolutely. So public health is involved in emergency preparedness. We work with local EMAs, we work with local first responders for a variety of things. Our biggest thing is coming up. Of course, we are heading into hurricane season, and on the emergency preparedness side, our team is very active in the sheltering operations that happen here in Macon-Bibb County. We get evacuees from the coast that come shelter here. We provide those medical services in those shelters. We don't run the shelters, but we are inside of the shelters providing care. In other emergency preparedness situations, in the event of a public health emergency, we would be the ones that are distributing the medications that might be needed to respond to such an emergency. But we also have things like our Medical Reserve Corps, which we are always looking for volunteers to join that. It is an emergency response volunteer organization that we want people to be involved in their community. So if anybody has any interest in that, we definitely want them to go to our website and sign up.
Yeah, anything else that you want to mention this morning or anything that you want to reiterate before we let you go?
So we know that we've been able to talk about some of these public health services, but I just want people to call your health department, learn about what they might have that you might not know that they offer. Go to our website to learn about some of these services and definitely take advantage. We are out there in the communities, we are out there providing these services, and we are out there for the individuals across the state.
Alrighty, well, thank you so much for joining us this morning. If people are interested in finding all of that information, like Mr. Hawkinson just mentioned, you can find your county's health department office and phone number by visiting nchd52.org/location. It's right there on your screen. I know that was a lot for you. There you'll be able to find a list of all 13 North Central Health District offices.